KUSKAYA is a Quechua word that means working together. It's incredible that the ancient Peruvians had one word for working together. They realized that unless you work together, you cannot solve things. The idea was to provide opportunities and training and practical experience to young professionals, different disciplines from different parts of the world, giving them the space and the time to identify problems that eventually can have an effect in health and approach them with a different view.
If we want to improve human health, we have to focus on both the animals and the environment around us humans. Echinococosis passes through animals. It primarily starts in sheep and alpaca and some cows, passes to dogs, and then from dogs to humans.
We've visited communities of shepherds, and it was really amazing experience to talk to the people there.
So after speaking with community members, sheep herders, community leaders, health representatives there,
we were able to work on our own project, design it, and put it forward ourselves.
What if you just train a community member to become a bit of an expert in control of the disease, and those individuals are the ones who go and deliver the dewormer for their community and create a good, effective supervisory system and bring in the community members to do that legwork.
No one stops learning ever. So being able to work with someone that has such a different background has helped a lot.
That's the beauty of the multidisciplinary aspect of this program.
It's not only physicians or public health or health providers that will solve the problems. I think it has to be collaborative. And that's what we are trying to do with KUSKAYA and start very early in their career.
I studied medicine in Cusco, here in the Andes of Peru. I was always interested in infectious diseases because they are very particular in our regions in Latin America. Here in Peru, the pharmacies are very widespread in the cities, in all of the neighborhoods, even more than the health centers, and they are often the first point of contact for people.
In Lima, having tuberculosis is a large problem and it carries a lot of stigma. And I think after HIV, tuberculosis is the largest infectious killer in the world.
Pharmacies can really help in detecting early cases, not to compete with the primary health centers, but to help them. With the use of cell phones, with the use of mobile database.
Working with Gustavo and in the KUSKAYA program was fantastic. Most valuable thing was getting immediate context on the team just from working with someone that is from the area.
I rely on the support of my colleagues. Many of them are not only medical doctors or in areas that are related to health, but they are, for example, engineers, they are computer scientists, they are veterinarians, and many people that are very, very helpful and very supportive for me.
Global health is too complex an issue to think that a single subject will give you a solution.
My project that I'm working on is an evaluation of different adaptation and mitigation strategies for climate change, and evaluating them based on the costs of implementation, impacts on ecosystem services, on public health, and on carbon output.
We are trying to develop a tool. It could be a spreadsheet or web-based. The tool will be used to help the administrators of public programs to prioritize the actions on climate change.
I'm an economist, but as economist, I don't know about chemistry or physics or physicist or history or sociology, and I think there is something that we lose in this specialized world that we are living.
There's a lot of potential for things like fog collectors to increase water supply, and there are several groups who are working on those in the more hilly regions.
For me, it's incredible, this experience, to see how economics could get involved in making the life better, but in a very concrete way.
We see a problem and we know it cannot be solved from one single discipline. To solve complex problems, we need to solve it from different angles.
KUSKAYA combines the best of very, very different worlds.
We come out of our comfort zones.
KUSKAYA have shaped a lot of my expectations about what I want to do for the future, and have helped me to decide that I want to work in public health.
Health has no boundaries. If you feel passionate about changing the world, it doesn't matter what discipline you are.
You have the opportunity to do it more for your people. Why not?